A little reminder too that this is information that we're sharing with you is confidential. Please don't reproduce it, don't share it. We will have a recording of the session made available to you a little bit later, so that will be shared more widely, so you can go back and you can listen to this again. So don't worry about taking too many notes. You will get the information. Just sit down and listen and take it in, okay? All right, let's get started then. Today's pocket-sized Pulse session is titled Engaging Your Customer with Pulse. We've just launched Pulse. We're very excited. It's a milestone for us at Prudential. Our first application that's been launched to the public, a wellness app. Everyone's buzzing about it. Everyone's excited. So how can you talk about it in a professional manner? How can you use it to engage with your customers and get them excited about it as well? We've got two of our presenters here today who are here to help you with just that. Our first presenter, she'll be no stranger to you, is Janelle Ang, who is from our L&D department. Many of you will have been trained by her before. Hi, Janelle. And then we have Gina Go, who's head of strategic marketing at the Brew Corporate Office, and she's going to be telling you a little bit more about our marketing campaign and referral programs. Okay, so let's get it started. I'm going to hand off to Janelle now. Janelle?
Thank you very much, Priya. Welcome and very good morning, everybody. So the first up, the main highlight would be how do you connect with your client, and of course, engaging with them and meeting the new ones who can benefit from our services. So the very first thing when you talk about Pulse is, if I can just move you to the very first highlight, is what are the two immediate benefits as conversation starter that you can share with them about the Pulse launch perks would be the first one. So Jenna, could I just get your help too? Yep, thank you very much. So the very first one in terms of the immediate benefit for your clients, be it existing or new ones, is let them know that we care. The COVID coverage takes care of them, as well as when we share more about Pulse in a short while, you will realize we are charging a flat rate of $15 for video consultation with a doctor. And this rate is applicable at any time of the day, 24/7. And of course, we know extras like your medication and delivery charges is separately. So coming back to this COVID-19, just share a little bit more is in terms of the hospital cash benefit. So for your existing Prudential Pulse customers, it will be a $200 hospital cash benefit until the 31st of July. And of course, we are also tapping into your public Pulse users, and that would be $100 until the 31st of May 2020. So right now, let's just journey to the talking points and connecting with our clients. So I will have the luxury to be able to enjoy being alive of FC this morning, and I'll be in fact inviting you to join me on board as I do a teleconversation and I do a tele date with my client Ankita. And you realize, if we were to start, it doesn't always have to be, a very formal conversation where I'm going to do a review with you, especially during this time. Maybe they have kids at home, they're going crazy, they just want to have some sanity. Date them for a coffee, date them for a tea. It doesn't have to be, sending them food if you want to connect with them on a lower cost platform. So right now, I'm just going to invite all of you. Join me as I am to do a tele date with my client Ankita, and I'm going to give her a call right this moment. So the phone is ringing. Hey, morning Ankita, how are you?
I'm bored and homeschooling my kids is straining my throat. I would like to go see a doctor, but I'm definitely doing my part to stay home and stay safe.
Yes, indeed. I mean, at this point of time, all of us are really just truly doing our part to stop the spread of COVID-19. But Ankita, did you just mention about your throat? You're not feeling very well?
Yes, my throat is feeling really sore.
Okay, this is perfect time that we're catching up this morning, because I'm going to be sharing with you this new wellness app that's launched by Prudential that is relevant for all of us right now. So Ankita, first thing first is, can I just show you, how does the app look like? Let me just walk through with you the key features.
Yes, please.
Okay, so first of all is Ankita, remind me, I believe you're using an Apple phone. So for you, you can
Yes.
actually download via the App Store. And I haven't forgotten
Okay.
your hubby. I know he's using Android unless he has changed. He can go to the Google Play Store. And Ankita, what you do is when you are at the download, there is a referral code that you can key in. So Ankita, just help me to fill in my code, which is 12345. Very easy. And I'm going to show you the interface of the three features that you'll be looking at. So the three features would very quickly be a health check, symptom checker, video consultation with a doctor, and that is why, Ankita, I mentioned it's relevant for us currently. So let me just quickly show you what health check is all about. But I'm not going to spoil the fun for you, so I'll still let you explore it later. But on a high level, Ankita, when you tap on the health check, there will be a set of digital questionnaire, and that very much is designed to give you insights into your long-term disease risk, as well as the changes you can make to reduce your risk and improve your long-term health. And when you are on the app, you will meet your digital twin. Go and check it out. You will actually have fun. And coming on to the symptom tracker, so you will realize that there will be a series of questions about your symptoms where you will interact with a chatbot. And of course, then they will suggest what's the most appropriate next step to take, as well as the possible causes for the symptom. And it can better help you better understand the worrying symptoms and direct you next best, how to seek further advice. But at this point of time is the next feature that is what we were talking about earlier that I mentioned is also very relevant now, is the video consultation with the doctor. So Ankita, this actually you'll be consulting with a Singapore licensed doctor online via video call. So I know for this morning you were saying that you haven't dolled up, you haven't put on your makeup, so we are doing a target call. But when you're with the doctor, it's actually via video. It's available 24/7, and they will review your symptoms and advise you on any necessary treatment. So I'm just going to pause here. And Kita, do you have any questions? Are we all good so far?
Yes. Will this doctor be able to give me any medication and issue me an MC if needed?
Oh, yes. So you will have actually an option. So if, let's say, the doctor, after reviewing the consultation, issue you an electronic MC, and of course, if necessary, they will also prescribe medication for you. And Kita, this is where you have an option whether you want the prescribed medication to be delivered to you, or you can actually pick it up from your preferred Guardian pharmacy.
I see. This looks exciting, and I can now consult a doctor from home with complete peace of mind.
Yes, that is very important. Please go and consult the doctor online. But the first step is remember to download the app and key in my referral code as 12345. But Ankita, I haven't forgotten why we are speaking with each other, because you text me and you wanted to find out more about the personal accident plan. But Ankita, I think you should rest well now. How about we catch up tomorrow?
Actually, I am prepared to sign, and because I just heard my neighbor had a fall at home and she didn't have any insurance. But I'm really worried to meet anybody in person at the moment.
Yes, indeed. I mean, we are also not allowed to meet anyone face-to-face right now. So, Ankita, please be assured, because here in Prudential, for us, financial consultants, you can actually allow us to do this protection gap from the comfort of your home. We can do it remotely via a video call. So shall we do it at 2 o'clock the same time tomorrow, or would you prefer the morning?
I prefer the morning, so let's meet at 10 a.m. instead.
Sure. 10 a.m. is good. So for now, download the app, see the doctor, and please rest your throat if you can today. Don't scream at the kids.
Yeah. Okay. Thanks, Janelle.
All right. Take care. Bye-bye.
See you tomorrow.
All right, so this is just a little snippets of, a teleconversation of how you can connect with your client and how you can actually bring in the topic of pulse, which is relevant for them. And if you realize that, how I actually started the conversation was using the stickers on Greenfly. So what you can do is download Greenfly, leverage on the ready-to-use social media marketing tools to engage them. And the good news is these are pre-approved materials for you to share on your social media. Now, coming back to this pro-remote advice that I was giving the client, the assurance that we can meet them online. So financial consultants or even agency leaders doing your personal sales, we do know that, we may need a couple of sittings in order to close the gap for our client. So even though it is done on a remote platform virtually, we still must ensure compliance with the regulations. So, and again, be face-to-face or remote. Okay, be kind to ourselves. It is very common that our clients will, some of us say they give us objection and we have to handle it. But the veterans, whenever they share with us, when agency leaders do your coaching, they will tell you that when a customer throws an objection to us, it is actually a wonderful opportunity where they give us a chance to address their concern. So we have this chance, grab it to ensure we are doing the best, the right solution for them and their loved ones. So in the next segment, let's just bounce off a few ideas. Of course, after the session, feel free to have your own role play with your colleagues, your agency leaders. But let's tap on the very first objection handling, giving us a chance to address their concern, which is right now, during COVID-19, they may tell you things like, FC, I kind of have a lot of time on hand. I can research a little bit more. And why I say this is good, because Mr. Customer, I'm really glad that you wish to research, because at the end of the day, financial consultants, it means that they heard you. They actually understand that they need this. They are interested. After all, insurance is a lifelong commitment for all of us, right? Especially for your clients who are paying if it's a whole life. So for all of us, because you are qualified, help them along, check with them which aspect would they like to find out more, and be glad to provide them with more information. So this is the first thing. If they say, okay, give me more time, let me research. But I know on top of your mind, you will be asking the second item, which is, customers saying things like, I have no money, it's a little bit expensive. All right, so let's really have to pause and check in with ourselves. At the end of the day, we are not closing a transactional sales. Our proper financial planning that we do for the client do actually bring value to them. So first thing first is like what we have always been taught is take a step back and check in with the client. Have we done our budgeting? Have we actually ascertained how much do they have? And more importantly, the number one rule perhaps is, why are they buying this plan for? Because we are not product pushing. All right, so if it's a death protection need, yes, we understand that, it's not the cheapest product on earth, but imagine, Mr. Customer, how much more difficult it would be for your family to cover your final expenses and the monthly cost of living with our loss of income. All right, and when we love our family, we do this because of them. Somehow, when the budget is also done right, we will find money to service this lifelong commitment because it's out of love. All right, so moving on to, I'm sure some of us may get it. Okay, they may have some reservations and they will share with you like, I already have a good agent. Okay, tell yourself number one first is, yes, we are wonderful. Okay, have confidence in yourself and check in with them. Okay, I would like to be a good agent. So Mr. Customer, please share with me, what did your agent do? Okay, and of course, at this point of time, we may have done a lot of talking. Pause and listen to them. Listen to them. What do they appreciate? What do they like about it? And it's actually learning points for us. But one other way where you can steer them back on track to have that conversation with you, and of course, you want to actually provide them with that protection gap, is, Miss Customer, Mr. Customer, what is better than a good agent? Okay, wait for their response. And actually, it's true. And we do know why, because every one of us in our daily life, we are practicing this just in case. Why two is better than one good agent is really just in case. Why we have multiple mobile covers, multiple pair of specs, and those of us who drive spare tires. All right, so this is something that we can have a conversation with them, address their concern. But coming back to today, when we talk about Pulse, some of you may actually have clients, giving you this particular feedback of, FC, I actually have a lot of apps. Why should I actually download it? So first thing first, let's take a step back and give them that assurance or give them that overview again that all of us, we have different health needs. So what if, just suppose you have a ready access to an app that understands your body and respond to your health needs and yours alone? Isn't that great? And we can actually do it at the comfort of our home. All right, so coming back, if let's say, you have heard us talking about Pulse, we know it's a digital offering in the health and wellness space, but what I'm going to share a little bit more is some facts about Pulse that allows you to further engage, because you will have these questions and we need to actually address it for you before you can better engage them, correct? So I'm just going to stand myself down from the video and I'll let you focus on the content. So first thing first, when we talk about the Pulse facts, many of you perhaps will be asking, we know that for Symptom Checker, for example, it's powered by Babylon. And one of the questions a lot of us is asking is, in terms of the context, is it localized for us? So yes, it is localized for Singapore in terms of the epidemiology, the language, the care pathways. And for some of us, if you're even wondering, like, can Pulse understand simple Singlish? Yes. Okay. So it has been trained, and we are in fact looking at developing a Mandarin version in the future. And of course, you know that we also be adding features in the future. Now, coming on, if you have heard my conversation with Ankita earlier, I did mention to her for the video consultation, it is actually by Singapore registered doctors. And these are actually locally registered GPs licensed with the Singapore Medical Council. All right, so this, please be assured of that. And moving along, when we talk about, powered by the Symptom Checker powered by Babylon, you'll be asking, like, who trains it? Who trains this bot? Because we'll be having that conversation with these chatbots. So these chatbots are actually trained by doctors. And they are actually reviewed and validated by these doctors, and it's also frequently tested. All right, so these bots are trained by doctors. However, one important thing to take note of is because, all of you have clients that ages perhaps from 9 months old to, 90 years old. So one thing is, you'll be asking, is this particular health check suitable for everybody? So this is actually more meant for adults over the age of 18. And if, let's say, any of our clients are actually currently pregnant, this will not be suitable for them, because you and I will know that they will have different needs and their medical conditions are actually slightly different. So this particular feature is more suitable for adults over the age of 18 and not for our pregnant ladies. All right, so moving on in terms of this number one concern, which is the data. So to give you the assurance, Prudential will not access this personal health data that's shared by the users. It is actually meant for the medical purpose, shared with Babylon and MyDoc. So all these info data collected is really meant for medical purpose to help these users, and of course to help the doctors understand the health conditions. All right, so this is something I know that you are worried about. But another thing, just to wrap up before we actually move on to the next presenter, is very important for you. Why do I say that? I strongly believe that, all of us, especially the veterans, you have your own unique way to engage. And it's really about having a conversation with your client, talking about Pulse, perhaps using the green 5 stickers as a door opener to just lighten the mood a little bit. But when it comes on to the do's and don'ts, this is something I need to emphasize. As you protect your client's protection need, financial consultants and leaders, please protect your business. When you promote Pulse, when you use Pulse to connect with your client and new clients, 3 important rules: be factual, okay, be careful, and be professional. What do I mean? So let's take a look at this: be factual. Okay, now we have to contain our excitement, because I know you're proud to be with Prudential, you're proud to have Pulse, but every information that we are talking about relating to Pulse, we must be factual, because at the end of the day, we are still governed. And the last thing you want is MOH to come knocking on our doors, correct? So you don't exaggerate it. We don't give misleading or, deceptive information. So over here, what you see in front is, some of us may be asking ourselves, what would be some good descriptions or what is some safe descriptions that we can talk about when we connect. So just a good example, we can say that Pulse is an AI-powered health and wellness app. Okay, provides round-the-clock access to healthcare services and information about your health. So the few descriptions there are just for us to take a look on how we can actually connect with our client and say it in the correct factual manner. Then the second item here would be still on being factual is, please, we really have to contain our excitement. We must not use any laudatory statements. So don't get too excited and then start telling them like, Mr. Customer or Miss Customer, this is the most advanced app. It's the best. It has the cutting edge technology. It's groundbreaking. All right. So these, unfortunately, please, it's a no. So just remember, okay, be elegant about this whole conversation about promoting Pulse. Give them factual information. And the other thing, if I move on to the next point about being careful. So at the end of the day, we also must do our due diligence. We must not come across, as giving information that solicit the use of the app. And what do I mean by that? You don't tell them things like it's free, it's complimentary, okay, no. But if you want to actually position it in a positive manner for them, you can say things like what you see here. It's a subscription-free app that can be downloaded on either the iOS or Android devices. All right, and earlier on, you have also heard me mentioning about the video consultation with the doctor. So it's available at a flat fee of $15, and this rate is actually applicable at any time of the day, 24/7. All right, so it's good to actually just remind them things like extras, like your medication and delivery, those are charged separately. It's always good to just give them this information. Okay, and of course, we know our prices will change from time to time. Okay, so again, I'm just going to highlight and repeat. Don't use words like free, discounted, complimentary, or, there's a validity period. So those are no. What you see in green, those are your good practices. Now, coming on also in terms of the last point of being careful, please, as much as we can, okay, put a reminder for yourself. We do not make any unjustified comparison. Okay, so manage the expectation. So on our end, what we do is we do not go and claim to the client that Pulse can diagnose COVID-19, because at the end of the day, this is not a diagnostic tool. Neither do we compare and contrast results with any other health and wellness app. All right, so be very factual. Tell them what Pulse is. If you need help, those items in the green boxes are actually good guiding principles for us. Let us promote Pulse. Let us do our business within the guidelines. All right, so moving on to this very important item, because for all of us after this session, I'm sure even at this point of time, you'll be asking about resources. So the next slide that you will see would be all the resources available. Yes, perfect. So first thing first, you'll be asking, can I have things like sales pack, sales script, because I still need some ideas on conversation starters, especially if, let's say, we are new in the business. So in terms of these resources, go into PruInfo. You have your Pulse Kit, which is your sales pack, your sales script. And what you can also do is, earlier when you saw how I actually use the stickers and the background, you can download Greenfly. If you need the access code, it is PRUSG Fly. Okay, so PRUSG Fly, that is the code. And the very last important resource for you is, if you need technical help, if you need a little bit more guidance in terms of Pulse, okay, you just give them a call at 6714-3939. So it's available Monday to Friday from 8:30 to 5:30, or quickly take a snapshot of the email address that you see here, pulse.ecosystem@prudential.com.sg. Okay, so these are the resources that is handy for you after the session, not now, okay, after the session, go and download it. That will come in very handy for your business. So right now, the next presenter will also be giving you a lot of good news that will help in your business. And I'm going to hand over the time to Gina right now. Gina, over to you.
Thank you, Jonelle. Jonelle, you have done a great job, and it's a great presentation together with Ankita on the device that you'll be equipped. And that's PRA and Pulse to actually help you to engage with customers better. I think ultimately, we as one Prudential would like to help everyone to manage life's live better. And that's why we launched Pulse. And I believe you would want the best for your customers, because I think there's so many angles that you can use. And particularly, I would like to point out 3. 1, you can use it from the wellness angle, 2, the convenience angle, and even the protection angle. And I think great news, from the protection angle basis, to date, we have about 6,591 signups for COVID-19 coverage in less than 1 week of launch. And I think I would like to applaud you, as you are really part of this success by being Prudential advocates to bring our purpose to life. So today, I want to speak to you about 2 things. Number 1, it's our marketing campaign that's going to support alongside with you to promote Pulse. Number 2, referral programs that's really no better time to actually use Pulse as a lead generation tool for yourself right now. So if you will be thinking, we are somewhat aware that in today's time, we can be very overwhelmed with the information we found online, right? Especially during this current situation of the global pandemic, which we need to really take extra care of ourselves and our families. And it's very natural. Anyone will feel anxious and frantically resorting to find a solution to keep safe, and leading to, do we know what's true, what's not? So a few instances of new news coverage that we have got. Some say ultraviolet light can kill coronavirus, and some say you can steam your face mask. I hope you don't do that. And that is the direction that we are actually taking for our campaign. So if you can see a very familiar figure that you will see here, she will be the face of our campaign. So this is a very exciting campaign, like I mentioned, to support your marketing efforts at this point of time. It is primarily digital-led, as everyone is staying home during the circuit breaker period. So we want to use this opportunity to really break the gloomy mood with a light-hearted and fun campaign. So you will see Michelle Chong giving crazy fun diagnosis, and it ends up with disastrous results. So if I can show you, it's already out on the social media. So you can see, I don't know whether you can see, I try to show my phone here, but the first campaign has already gone out. And separately, we are also working with SGAG Pam. If you know this persona from SGAG, she always calls someone Bodo Bodo, and she's going to work on some funny script for us as well. So watch out for that, because with all this fun localized stories, Pulse will be positioned as a tool to actually encourage to dispel fake news and to drive people to official and reliable sources. So the emphasis will be on Pulse's ability to provide relevant and credible information. So you will see all this content being anchored on various digital platforms like Instagram, Facebook, search ads, YouTube. So what you see on the right here is actually a very simple diagram how we actually help to drive Pulse downloads through all the marketing channels. So this marketing drive is all about supporting you from reaching out to existing customers, creating content for you, drive online traffic to download Pulse. So I can't emphasize much more, it's a very good lead generation tool for you, right? So what's in it for you? All right, there's so much going on, and I just want to go on to the next slide. I think you're very familiar with it, is that I think of course we want you to talk more about it. And I believe this is the details that you have seen over the last week about the FC's referral programs over the next 3 months. With over 10,000 to win by the top 100 FCs. So how do you do that? You should make full use of the COVID-19 coverage that we are offering for customers to download Pulse. And judging by the subscription, you have really done a great job already, right? So today, I will not go into the nitty-gritty details, tell you step by step, because all I want to remind you today is to remember to remind your customers to register for the PruCare package, the COVID-19 package, with your unique reference code, which is your FC code. Okay, this is going to benefit you in terms of how we're going to push out marketing information to these group of customers, and which is the next section I'm going to talk about, is leads. Right? How do we make use of cross-sellings with leads assignment? And as mentioned, it's a tool to generate leads, at the same time to engage and inspire your customers to manage their runs. So if you pay attention to point 2, the more new to Pru customers registered for Pulse, the higher leads are generated for you. So that's why you are working so hard to get these customers on board. And that is why number 2 is very important. And from the slide, you'll see that we just put our first cross-sell campaign will be a Pru Pack campaign. And you will have more information next week. So it's going to help you to engage with new to Pru customers, which you can actually keep a lookout on that. So I appreciate your attention and making time early today, and you have been great. So I'll hand over to Priya so that we can actually go into the Q&A session. Over to you, Priya.
Thanks so much, Gina, and thanks so much, Janelle, as well. We have quite a lot of questions, so everyone's very engaged. We're going to try and get to as many of them as we can while still staying on time. So we've got a number of people here with us today who are here to answer your questions. Besides Janelle and Gina, we've got Ariel from our marketing team. We have Pise, who is from the Pulse development team. And we also have with us Dr. Siddharth, who's the head of our medical team here at Prudential. And he's also been very, very closely involved in the development of Pulse. So let me get to it, guys. And I'm going to be throwing you some of the questions that have come through so far. First things first, in terms of getting hold of information, someone asked, where are the recordings of these sessions going to be made available? Let me answer that first by telling you guys that we'll be sending out an email communication to you guys, Pru message, with links and so forth to let you know when those recordings are made available, and we'll do it as soon as we can. Okay, there is a question, Gina, is there going to be an EDM or a link or a WhatsApp type message that's going to be made available to the consultants so that they can kind of easily update their customers regarding Pulse? Is that available?
Yes, in fact, I think recently we have, last week we have sent out the launch communication, and that's actually included all the necessary information for you to do the download.
So they just need to go back and refer to that launch comm, yeah, for that information. There's been a couple of questions actually about the doctors that we can see using the video consultation feature. So maybe Dr. Sid, if I could toss that question to you. The question is there a list of doctors that customers who download the app can actually choose from, or is it something that's automatically assigned to you when you click, I want to see a doctor? And also related to that, are the doctors available 24/7? And are they real doctors or are they virtual doctors? That was actually another question that was asked. Yeah.
Sure. Thanks, Priya. That's an interesting question, especially the second part of the question, whether the doctors are real or they're from the virtual world. So to answer this question, let me first take up the first part of the question, that whether there's a panel of doctors. So we are partnering with MyDoc, which is our telemedicine partner within the Pulse by Prudential app. And what happens is that because the service is available 24/7, MyDoc has their own list of doctors who keep on rotating in terms of being available 24/7. So there is no specific list available at the beginning of the consultation where a user can actually pick and choose. But depending on the doctor who is on call at that particular time, that doctor is allocated to the user if there's a need for telemedicine consultation. So that's to answer the first part of your question. Now to come to the second part of the question. So these are real doctors in flesh and blood. These are doctors who are certified and licensed with Singapore Medical Council. These are GPs with a minimum experience of 12 years practicing here in Singapore. And for these doctors, besides being accredited with the Singapore Medical Council, it's also very important that they have passed the validation and certification course for telemedicine providers that the MOH has set up for these doctors. And only once when they qualify for this certificate does MyDoc allow them to do telemedicine. So the point here is that there's a very stringent process of identifying the specialists, the doctors who would actually be providing teleconsultation services to users of Pulse. Thanks. Over to you, Priya. I hope this answers the query.
Thank you. Thanks so much, Dr. Sid. Okay, there's been a couple of questions. A couple of you have been writing in to ask about the $15 video consult fee. So the first question is this applicable to our enterprise customers as well as, I mean, obviously their employees and also dependents who may be on this plan? Could I ask, Pise, would you be able to take that question? Is it available to our enterprise customers?
Thank you, Priya. So for this flat rate of $15, it's applied to all Pulse users who are the who have a valid, an OIC or NPIN number who reside in Singapore, and they have to be 18 years old or above, and when they consult with the doctor, their condition should be something that is allowed to be consulted during the video consultation. So if the enterprise customer are the Pulse user who meet all of these conditions, they can also enjoy the flat rate for the $15.
Thank you. Also related to that, Ariel, if you could, if I could ask you a question, the COVID cover that comes when you download the Pulse application, is that on top of the current PruCare package that's already available? So is it an extension of the coverage? How does that work?
Okay, so this is definitely an extension of the current PruCare package. So for anyone who download Pulse and also register for the COVID-19 cover now, they will get an extension from 1st July to the 31st of July. So for existing customers, you get $200, all right, basically a daily payout for your hospitalization. And then, of course, we are extending this time round to non-Prudential customers as well. So from now till 31st of May, if they sign up, they get about $100 a day, right? And they can claim once they are, declared certified having COVID-19 and hospitalized, they can claim up to 3 months, 90 days, in fact.
Okay, and is the, related to these questions really is a question on, is the Pulse app usable by foreigners? Is it usable by, for instance, domestic workers? Will they also get the same type of coverage and also $15 flat fee? How does that work, Ariel?
Okay, so for Pulse itself, as PCA just explained earlier, so as long as you have an NRIC, valid NRIC and FIN card, you can download Pulse, sign up, and leverage on the $15 MyDoc consultation. However, for the complimentary COVID-19 cover, for existing customers, we are basically extending to anyone who has purchased a Prudential policy. But however, for non-Prudential customers, this is only extended to Singaporeans and PRs only.
Okay, thank you. That's very clear. There was thanks, Ariel. Thank you. And guys, if you want to go and check out what is the criteria for qualification for all these benefits, they are up on our website online as well, so you can go and check that out online, so you can read that in detail. Okay. Somebody asked, why is it important to input the referral code? Why is it important for someone to input the referral code into the app? Is this the 5-digit FC code? And I think related to that as well, how are FCs going to know if someone has done so? How are we going to notify them that their customer has done has entered in a referral code, and they know that, hey, I've got one download in. Is that something you can respond to as well, Ariel?
Yeah. So the 5-digit referral code that we're referring to is your FC code, which you will advise your customer to input in both the PALS profile page as well as the free complimentary COVID-19 sign-up page. Now, it is important that you ask them to input for both, especially if for qualification of the referral program, we will be taking the referral codes coming from the COVID-19 registration page. So that's why it's important that you put it in there. Yeah.
Okay, thank you so much. And Ariel, since I have you here, I think lots of questions related to the terms and conditions. Is there a deadline for folks to download PALS so that they can sign up for the COVID-19 cover and qualify for that? Is there a deadline?
Well, we would, in our communications, we basically nudge our customers to sign up by the 8th of May. And as you already know, for non-Prudential customers, the cover is only up to 31st, or rather the extension is only until the 31st of May. So we would want them and nudge them to sign up quickly so that they can benefit from this $100 cover. Yeah. But if they were to sign up after that, we will still take that in.
Okay. Okay, great. All right. I have a question here regarding the consultation fee of $15 again, and we had talked about this being a flat rate, but we continue to get a couple of questions on whether it's a promotional rate or whether it's a standard rate. Now, Janelle, can I ask you to take this and maybe kind of like reiterate the point that we want to make regarding the $15 flat rate and why we use the term flat rate?
Sure. Okay, so earlier, if let's say we would do a recap, we talk about tips about promoting PALS. So right now, it's very important, to just mention flat rate and don't add on to say that it's just valid for a particular period of time. And on top of that, other than saying that currently right now is this $15 flat rate, I also mentioned it's good to just add on to tell them that this $15 flat rate is applicable at any time of the day, 24/7. Of course, the other concern that your customer will be asking is, how about medication and delivery? So these are actually charged separately. And it's good to just end off by letting them know that, of course, prices will change from time to time. So importantly is, please don't mention that it's valid for a particular period of time, because that may perceive as we are trying to solicit them to use the app or its feature. Yeah, I hope I've addressed that, Priya.
Thanks so much, Janelle. Yes, that's a great answer. Thank you. There is a question here. It's a rather interesting question. So obviously, some of our financial consultants, they've downloaded it, they've used it, they've tried it out, they have their own view on the app. So someone's asking, what are the other engaging features that we're hoping to build, maybe in the short or the longer term, to get people to come back to revisit PALS and to use PALS again? Because it could be that someone just kind of downloads this once and then they don't, maybe they use it for one telemedicine, a virtual consult with a doctor. What are our plans to keep people kind of engaged using PALS? Gina, would you like to address that question?
Sure. I think that is a very good question. We need to make sure that we continue to engage these customers. Like we mentioned, it's going to position as a lead generation tool for you. So the engagement work should not stop. That's to the point. And there'll be a lot of great features that we're going to roll out. It's just not going to stop here. Apps is going to evolve. The app is going to evolve in different phases. And I think I can just let you know the phase that we are actually developing going forward is actually the rewards piece. That is going to be quite exciting as well, to continue to engage customer on a more continuous basis. I hope that answered the question, Priya.
Yes, thanks so much, Gina. Okay, great. So this is just like the first phase of the launch. There will be more in the coming months and even the coming years as we kind of build new features and functionalities into Pulse. Let's get our first phase off and out the road first, and you'll hear more from us on those other elements in the coming months, yeah? Well, there has been one question that has been asked several times, and Dr. Sid, I'm going to ask if you could take this question, please. Does Prudential have access to the medical information that people input into the application, and how is that information used, if it's used at all?
Thanks, Priya. I think this is a very relevant question, especially in the current environment where we talk about personal data protection, et cetera, et cetera. So to answer this question, the answer is no. When I say no, what exactly does that mean? That means that Prudential does not have access to any medical or health-related data that our user puts into the system into the app for using any of the functionalities. Now, as we have discussed, the app has 3 functionalities for now. One is a health check, one is a symptom checker, and one is the telemedicine. So these are the 3 functionalities, right? So whilst the user could be putting in medical data for any of the 3 functionalities, we do not have a view or an oversight into any of the medical data from a Prudential perspective, and this data is respectively stored with our partners wherein we don't have access. What that actually means that as we do not have access to any information, we would not be using this data for any underwriting needs of the policyholder in the future. So effectively, to give the comfort to everyone, we have absolutely zero oversight of the medical data that goes into the app. Thank you.
Thanks very much, Dr. Sid. So that's good to know that we are going to be safeguarding that information. PC, I know we talked about not wanting to take on too many technical questions because during this session, because our focus really is on how do you engage the customers and what are the collateral that we have available to help our financial consultants do this. But there have been several questions about downloading onto certain types of phones. So we've had a couple of comments where folks are telling us that they can't download the app onto, or they're not sure if they can download the app onto Oppo, Xiaomi, or Huawei phones. Is that possible now at this point in time, or is it only Android and iPhone?
Priya, for Pulse, it's available to be downloaded for iPhone and Android user. You can go to App Store or Google Play Store based on your phone device. And I might also make a suggestion here. Once they download it, one thing that they can try to do is to click on Forget Password, just to test if they cannot sign up for the first time. Click on Forget Password, then they should receive an email with the password, the new password that they can key in. Now, in this case, after doing this, they still face the issue. I would encourage to send the email to our call center support team, which is the paul.ecosystem@prudential.com.sg. So that, and attach the screenshot if possible, so that our team can help assist you accordingly. Yeah.
All right, thanks a lot, PC. We continue to get some questions about the virtual consultation with the doctor. So I think I'm going to go back to you, Dr. Siddharth. When they go and see the doctor, or when they choose this functionality, are they actually able to repeat visit the same doctor that they may have seen before? Can they, if I've seen someone once and I use the app again, can I choose, or will I just get assigned a doctor?
That's an interesting question, because what happens is that, again, as I explained in my previous answer, is that you cannot effectively choose if you're doing an online virtual consultation, because it all depends on the doctor who is on duty or on call for that particular time slot. But there is nothing stopping from the user to then go for an offline consultation with the same doctor if the user believes that they need to go and see the same doctor. However, online, because there's a system of which doctor is on call at what time, it might not be again possible to again go back and select the same doctor, but nothing stops from an offline consultation with the same doctor. Over to you, Priya.
Thank you, Dr. Sid. Please say you have something to add.
Yeah, just to add on to Dr. Siddharth's response as well, so after the first or second consultation, and if you wish to, to talk to the same doctor, within 7 days after that first consultation, you can actually contact My Doc Medical Concierge, which is available in the chat function within Pulse by Prudential, so that you can inform the medical concierge that you would like to talk to the same doctor for your next consultation. However, like Dr. Siddharth mentioned, it's really also based on the doctor availability as well. Yeah.
Okay, thanks. Thanks so much, Dr. Sid and PC. Dr. Sid, just back to you again. There continue to be questions on who can actually, who's the app suitable, and this is from a medical perspective. In terms of age or in terms of like their physical condition, who should be using this application?
Good question. I think first of all, since this is an app which basically provides end-to-end healthcare solution and healthcare functionalities, this app is suitable for people who are about 18 years of age, females who are not pregnant, and also, and I'm here talking about the healthcare functionalities of the app from a symptom checker perspective and a health check perspective. And those people who have dermatological conditions, that's skin conditions, the app is not suitable for these three groups of people. That's the first part. The second part is, as in case of any app, you see at the end of the day, this app does not replace a doctor per se. It is not giving you medical advice, but is telling you about what could be the potential conditions you have and what is the risk you have from a healthcare perspective. So therefore, I as a doctor would suggest that if there are cases where there's a need for emergency access to healthcare, you should actually not be using this app, but rushing to the nearest A&E. But otherwise, for the routine issues that a person might have where they believe that they need to get their symptoms checked through this app, and is nothing serious from an emergency perspective, it's okay to use this app. So having said that, the three groups of people who are not covered here, because this app has not been, from a data perspective, has not been sort of fine-tuned to their requirements. So these are the people who should not be using this app. And any medical emergencies where the user believes that it's a bad health condition, the best thing would be to go to the nearest A&E or check with a real doctor instantly. Otherwise, this is a reasonably good ad with a lot of data that has gone into the back end, a lot of epidemiological data that has gone in the back end. And the symptom checker here in this app covers almost 80% of the common health conditions that normally GPs see in Singapore. It's been localized accordingly. So that way it's safe to access the app and check on the symptoms. Over to you, Priya.
Thank you, Dr. Sid. Okay, we've got time for just one or two more questions. I think, Ariel, I'm going to direct them to you, please. Related to what Dr. Sid mentioned about the suitability of who should be using this application, there's been a question on, can children download Pulse? Let's say they have their own mobile phone because their parents gave it to them. Can they download Pulse, and will they then cover for things like will they then qualify for things like the COVID coverage and so forth?
No, technically anyone can download Pulse, right? If you give your child permission to, but Pulse is recommended, I think, as what PC mentioned, 18 and above. And for the COVID-19 cover, it should be, of that age as well. So.
Okay, so recommended that the users of Pulse should be 18 and above, right?
Yes,
okay.
Correct.
Okay, so that's clear. Another question for you, for non-Pru customers, any marketing restrictions, for example, any PDPA restrictions, for instance, to market Pulse to them, for instance, via WhatsApp?
Hello.
What's your
sorry, can you,
to,
sorry,
can you repeat
again? This? Yeah.
So for non-Pru customers, meaning they are prospective, maybe someone new, we don't know who they are. There? What is your advice on how FCs should talk to them about Pulse or to market to them? Are there any restrictions on using Pulse to market to such customers? How do they go about doing that? If they have a prospective customer that they want to kind of like engage in with the conversation, any restrictions in terms of using Pulse to talk to them? What should they be mindful of?
Okay, so for Pulse, just be mindful that anyone with a valid NRIC or FIN can download Pulse and leverage on all the features that are made available. So I would encourage the FC to, of course, start with a wellness conversation, right? So this is where we want to lead in that space. So and have that conversation on how your prospect can benefit from using Pulse. However, with regards to signing up for the complimentary COVID-19 registration, again, we are only offering this to Singaporeans and PRs, okay? And it's only up to the 31st of May. So please be mindful of that so that you don't offer your prospective customers with FIN cards and say that they can actually sign up. They cannot. We're not offering that for now, yeah.
Okay, great. So a reminder to everyone, if you need a reminder on the terms and conditions, either for the video consultation flat fee, who's eligible or who can download, or a reminder on who's eligible for the COVID cover. Guys, it's on our website. You can read the terms and conditions there. So just do a quick Google search and you'll be able to find it. It's available there for customers to read through as well. I'm going to have to bring our session to a close because we're out of time. We had so many great questions from so many of you. We've taken note of all the Q&A. What we'll do is we'll round off in a couple of days' time with responses to some of the most frequently asked questions. We'll send those around as well so that other colleagues who may not have had a chance to attend the session can also benefit from some of the questions that you've asked today. So I thank all of you very, very much. Close to 800 of you have joined us today. Thank you for joining us for our edition of Pocket Size Pulse on how to engage your customers. All right, so thanks very much everyone for joining us. I want to thank everybody for joining us today. Once again, thanks so much for your questions. Great questions, a lot of questions. We're going to put everything together. We're going to respond to them. Please do refer to some of the launch material that was also sent out. You may be able to find your answers there as well. And go on to check out some of those as well. Yeah. So guys, thanks so much. We're going to end the meeting now. Thanks so much for joining us today. Bye-bye. Take care.